Keeping you out of one of these places means you need to pay attention to your heart health. Indeed, taking care of our heart health may be the most important health policy issue across both the Ozarks and the rest of the country. Here's why.
Heart disease is the #1 killer of both men and women. It kills more people than all cancers combined.
That's an amazing revelation. With the attention given to different forms of cancers, it's easy to forget that heart disease looms very large as a health threat. This graph from the Centers for Disease Control and Prevention tells the story, with heart disease responsible for 165 deaths per 100,000 Americans in 2017. To be sure, this heart disease rate applies to both men and women, the latter especially after menopause, making heart health crucial no matter your sex. So what works to reduce your risk of having a major heart problem? Dr. Matthew Butoff, a professor of medicine at UCLA's David Geffen School of Medicine, runs us through the options.
There's some great therapies out there that help us reduce the risk. We have aspirin and statins that have lowered cholesterol and really helped us reduce our risk.
Statins are prescription drugs that work to reduce cholesterol production in the liver, which is actually where most of your body's cholesterol comes from. This is why diet, though important, does not protect your heart from problems alone. If your body is prone to producing more cholesterol, you'll have higher levels of lipids, which include fats and chemical reactions in your body that produce cholesterol. It's also why combining diet with statins has shown inconsistent results.
As we've been using statins, we've tried to add dietary supplements, and we've had some very mixed results. The dietary supplements are not regulated by the Food and Drug Administration very carefully, so what's in the capsule is not always what you're getting.
Now, none of this means you should ignore diet and exercise. Both are critical in supporting heart health, as is giving up cigarettes if you're a smoker.
Statins are excellent, but we want to find out our individual risk, talk to our doctor, and if needed, go on additional therapies.
At a minimum, this means seeing a doctor to check your cholesterol levels. But this also means that keeping your heart healthy isn't just a matter of personal responsibility. Access to treatment and preventative measures is also part of the discussion. And that gets us very quickly into politics. The state legislature continues to debate budget efforts to improve resources for medical care and access across the state. But as is often the case with the state budget, funds are scarce. Still, Democratic House Minority Leader Crystal Quaid says money for medical outreach is critical.
So budgetarily, anything we can do to help our federally qualified health centers like Jordan Valley to put funding into these programs that we know are working so that they can reach out to folks across the whole state of Missouri. We have a lot of rural clinics that are under that same type of programming. But then, of course, we're looking at programs that we can do to increase enrollment and make sure that folks are covered. And that goes well beyond our kiddos, but we're looking at programs like MoRx and making sure that that is restored, in-home nursing care, bringing back some of those restorations. But it's also very intersectional with other things that we're seeing in Jefferson City. Healthcare goes beyond just the doctor's office. It goes to access to quality food. It goes to transportation pieces to be able to get to the doctor.
Whether Missouri has enough money to support community health outreach, awareness and prevention can start with you right now, tonight. A holistic approach to your heart and your health. Diet, exercise, and maybe medication are key, so check with your doctor. And so here's to your heart and your health. And we'll be back after this.